Okay, we are live. Hi guys, this is Dr. Yuvraj again from Positive Physiotherapy. Good evening, and welcome to the second part of our series with R360, where we are going to help you guys combat the side effects of lockdown in a better way. Positive Physiotherapy is a musculoskeletal and sports specific physiotherapy expertise in musculoskeletal and sports injuries. We are located in Andheri East, and there are other clinic is in Thane West, and we are open now. So you can contact us if you have any issues. And our partners here are R360, and we are live through their Instagram channel. R360 is an elite fitness and lifestyle club with focused on holistic approach towards health and well-being. Their philosophy is inspiring their clients to make a shift, and they believe in a call to action of making that shift. So visit them, and once the lockdown opens up, please visit them and know more about how to do it. In the meanwhile, as we are all stuck at home, today we are going to address the problems of those people who are the corporates, those who are stuck at home doing work from home, those who have to work 8 hours, 9 hours, 10 hours, attending to calls, using the laptop, and they end up with a very poor posture. At home, we don't have the kind of desk which we have in the office, so many times we are ending up with poor postures, lack of mobility, and aches and pains in the neck, in the back. Okay, so today we are going to discuss simple exercises which can be done specifically for those corporates who are stuck at home. Okay, great. Okay, so again today we have Oshin here. Hi Oshin.
Hi.
Okay, so we are going to first discuss 3 exercises we have divided your work into 3 categories. Category A are those exercises which we want you to do when you are sitting in front of the laptop. Okay, category B are exercises which we want you to do as a part in the morning or the evening, which are kind of mobility and strength exercises. And there is an interesting category C which I will talk to you about little later. Okay, so category A, okay, is your postural exercises which we want you to do when you are working, when you are in front of your laptop. Okay, so first exercise is called as is a slouch overcorrect. So imagine this is how you are sitting in front of a laptop. Okay, and imagine this is a chair. Okay, so what we need to do in this is, after let's say 1 hour of working, you are going to do slouch overcorrect. Okay, slouch overcorrect, you have to sit slouched first, that is keep your neck straight, and slouched is you are bending from your thoracic and lumbar spine. Okay, now this is the worst possible posture. Okay, now from slouched position you are going to go into an overcorrect, that is you are going to go absolutely tall. Okay, imagine there is a thread on the top of your head which is pulling you straight up, elongate your spine. Okay, again you will go into slouch posture. Yes, wonderful, Oshin. And then you are going to again go into an overcorrect posture. Beautiful. Slouched, so you are moving from your pelvis, your lumbar spine, your thoracic spine, okay, and a little bit from your cervical, and then you are going to go into overcorrect posture. Now once you have reached your max posture, okay, 100% of your sitting height, just release by 10%. Khatam. Yeah, that's it. Okay, so you are released by 10%, and now you will get back to work. Okay, so this is one exercise where you're moving your spine into flexion, and then you're extending it completely. You will do it 10 to 15 times, release a bit, and then you will get back to your typing. Okay, so that is your exercise number 1, Oshin. Wonderful. Okay, exercise number 2 is we call it semi-spinalis activation as physios, but it's just leaning on a stool and nodding your head. Okay, so this is going to work on a very specific muscle which gets weakened in people with a forward head posture. Okay, so let's say she is going to demonstrate. Okay, so this is how she is going to start. She is keeping her elbows on the table. Okay, yeah, and then now she is going to do a slight chin tuck, and chin tuck is just holding the chin backwards. She is going to drop her neck down, so very slowly, and then slowly look up. Okay, now this is a kind of a precision exercise. Okay, the only part of her body which is moving is her cervical spine. Okay, and she is maintaining the chin tuck throughout the movement. Wonderful. Okay, and down. One more time. And up. Beautiful. Okay, so second exercise was head nods, which we can call this head nods on the desk. Okay, so two exercises we did up till now. One was a slouch over correct, and the second was head nods supported with the arm supported on, with the forearm supported on the desk. Okay, now in this is both the precision exercises. Do it very slowly, very gently, and you have to keep on doing these exercises multiple times in an hour. Okay, the third exercise is a kind of a stretch, because when you sit for a long time, you end up with tightnesses of your shoulder. Okay, front of. So what we want to do is we want to stretch that out. Okay, so we call it Shah Rukh Khan stretch. Okay, and this is how we do it. Yeah, so we are going to basically go into a Shah Rukh Khan's favorite position. Okay, you're going to open up your chest, you are going to move your wrist backwards, you are going to extend your elbows, and you're going to look up a bit. Okay, you hold this for 10 counts. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and you will relax. Okay, yeah, you will get a nice stretch on the front of your body. Okay, your chest, your biceps, your forearm, and your wrist. Okay, and this is the exact thing which goes into tightness when you work for long hours. Okay, one more time, Oshin, we'll do the Shah Rukh stretch. Yeah, wonderful. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and done. Beautiful, Oshin. Okay, so three exercises we have done. Category A, as I told you, these are exercises which you keep on doing throughout your working time. Those 8 hours, those 9 or 10 hours when you're sitting, you keep on playing with these exercises. There is do them 10 times every hour. When you get up, you do the Shah Rukh stretch. If you can't get up, do your slouch or correct. If do your head nods. Okay, so these were beautiful 3 postural exercises to avoid back pain and neck pain when you are working from home. Now we will work on a little bit of mobility of your spine, because this again gets stiff when you sit for a long time. The first exercise which we are doing is thoracic extension using the stool. Okay, you can use a stool, or at home you can use a chair or a sofa. Okay, so to kneel on the ground. Okay, and then okay, you are going to do a nice stretch. Ensure your head doesn't drop down. Okay, this is wrong. Head remains straight. You are pushing the buttocks back. Okay, you are keeping the hands on a chair or a sofa, and you are pushing the buttocks back, and you will get a nice stretch in your thoracic spine. Yeah, in this region, the latissimus and the thoracic spine. Don't drop your head down. Okay, it's like again think of elongating your spine when you are doing this. Okay, elongating the spine. Yeah, and go back into straight position, and we will do it one more time, and we'll hold this for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and up. Wonderful, Oshin. Okay, so this we call as a thoracic stretch or thoracic chair stretch. Okay, the second exercise, thoracic spine is very important, guys, because this is the same thing which gets stiff if you sit for a long time in front of the laptop, or you are working in the kitchen for long hours. This is the part which gets stiff, which creates the problem. The second mobility exercise which we are going to do in the same position is thoracic rotations. So we will go into again all 4 position. Okay, you will keep your leg out. Yeah, leg is in 90 degrees of abduction. Yeah, toes pointing sideways. And then you are going to open up the left hand and go up. Breathe in while going up. Yeah. And you are going to breathe out as you breathe in, and take the hand fully in. Beautiful. Okay. Breathe in as you go up, and breathe out as you come down. One more time. Breathe in. No holds here. We will just do it 10 times per side. And breathe out as you come down. Wonderful. Okay. So second thing which we did was thoracic. Yeah, show it on the other side. Yeah, breathe in and breathe out. Breathe in, breathe out. Breathe in and breathe out. Wonderful. Okay, take a break, Oshin. Okay, so we worked with 2 exercises which were specific to your thoracic spine. Okay, and the third mobility exercise which we will do is called as a windmill stretch, or we also call it as the Madhuri Dixit stretch. Okay, and we are going to go into the Mardala position. Okay, we are going to have a windmill position of the hips. hips 90, knee 90, the other hips in 90, and the other knee is also in 90 degrees position. Okay, let me take a better angle motion. Yes, go now. Yeah, okay, yeah, and then you are going to crawl in front. Okay, wonderful. Then you are going to walk with the hands towards the right side. Good. Keep the forearm on the ground. Yeah, and then you are going to open up and open up. One. Okay, keep on doing this, Oshin. I will change the angle. Yeah, 2. If you can see Oshin doing the exercise here. 3. Good. 4. 5. And 6. And wonderful. Okay, and crawl back, Oshin. Yeah. And crawl back. Wonderful. Okay, so this you will do it on both the sides. Is your wonderful mobility exercise, which is called as the windmill stretch. Okay, and all these videos which we are showing are available on our YouTube channel. You can look it for positive physiotherapy on YouTube, and you will get those exercises which we are speaking right now. Okay, now then we will go for 3 exercises which are a kind of strength exercises, little bit of low intensity strength exercises. The first exercise, which is for another muscle which generally gets weakened in most of those who are sedentary, is the buttock muscle. So in this position you will come and we will do the Pilates exercise. Yeah, sideline. Not recorded. Okay, in sideline position, you are going to ensure your shoulder, hips, and your ankle are in a straight line. The leg which is on the downside remains bent. Okay, you will take the left leg here slightly up. Okay, so that it is in line with the hip. As you move the leg in front, you are going to take your ankle upwards, and as you move the leg back, you are going to take the ankle downwards. Keep on doing this motion. And 2, and back, and 3, and back, and 4. Yeah, and ensure your pelvis doesn't dip backwards while you're doing this. Okay, the pelvis stays in position. And wonderful. Take a break. Do it 10 times. Maybe you can do 2 or 3 sets of this exercise. This exercise nicely works up your buttock muscles. Okay, and that is a very crucial muscle which generally gets weak in people who are stuck up at home and doing desk work. Okay, the second exercise is out and up. Okay, this exercise is for the rotator cuff muscles. It's for the slouch posture. Yeah, so it is mainly to correct the slouch posture. Okay, so what we are going to do is going to hold buy a TheraBand. This is easily available in any sports shops. Okay, the different levels. Buy a low intensity one to start with. Okay, you are going to hold the TheraBand at shoulder width distance, driving kind of a stance. Okay, stretch it out a bit. Okay, hold that pose, stretch, and take the hand straight up. Beautiful. Maintaining the stretch, full up, and then bring it down. Yeah, maintaining the stretch up and bring it down. One more time motion. Maintaining the stretch, go full up and bring it down. Wonderful, great. Okay, so exercise number 2 of strength which we did was your out and up using a TheraBand. Okay, the third exercise which we do here. Okay, we can play with a few more TheraBand exercises here, which we call as the cheerleader exercises. You can do this using the same TheraBand. Yeah, and you can do this. Okay, yeah, or we call it sword, we can call it cheerleader. There are different names, but this is again an exercise which are going to work on your scapular muscles, scapular adductors, which are going to get strengthened, and you are going to get a nice erect posture. Okay, do it on both the sides for 15 times. Yeah, and we'll do a few times on the other side. Good, wonderful. Okay, and then we'll just reverse this position. Okay, now what you do, hold it up and then you bring it down. Okay, so it's a cheerleader exercise. Nice, great, wonderful, and great. Okay, great, wonderful. Okay, So we did a few exercises with the TheraBand, and now we'll move on to an exercise which is again for a muscle which is called a serratus anterior, which is a very crucial muscle to maintain erect posture of your thoracic spine, okay, and not get a slouch posture. Okay, so we'll go into a push-up plus position. Wonderful. Yeah. Okay. So we are in this position. Perfect. Oshin. Yeah. Okay. So in this position first, yeah. So your spine is remaining absolutely neutral. Okay. You should not create what do you say? Let me show from this angle. Okay. Yeah. You should not create a gap here. Okay. It should be up. Okay. It remains flat. Our scapula are absolutely flat. One more time. Go down, Oshin. This is wrong and this is good. Okay. Or you can do this itself as an exercise, which is called as the scapular push-ups and up. Okay, the neck remains neutral, the lumbar spine remains neutral. You are only moving from your scapula, dipping it down and taking it up. Now, once you take it up, elbows remain fully extended. Yeah, thank you, Oshin. Okay, once you take it up, hold this position. I mean, hold for 10 counts. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, take a break. Okay, now what we do, we take it up again. Okay, and now as a progression, we move one hand. Lift your left hand slightly up. Maintaining the push-up plus position, take it outwards. Wonderful. And take it back in. Take it out. Take it back in. And you will get a nice contraction of the muscles, the scapular muscles on your right side. Right, Oshin? Yeah. Yeah. And then you can do it again on the right side. Now the left hand now is on the ground now. Wonderful. Precision is very crucial, guys, in these exercises. Do it very, very slowly. Okay, and back and done. Wonderful. Great. Okay, thank you so much, Oshin. Okay, guys. Okay, so we are back. Okay, so these were some simple exercises which you can try at home. There are a few postural exercises which we discussed. There are a few mobility exercises for your thoracic spine which we discussed today. There were a few strength exercises for rotator cuff. Okay, which will and scapular adductor will help you maintain this posture. We discussed a few exercises for your buttocks, which is the base of support for your entire spine. So if buttock is strong, your spine remains nice and straight and erect. Okay, simple exercises. Play with them, enjoy them, and you should find them. Okay. Now let me tell you, quickly share you a few interesting facts about posture. Now, coming from sports science, coming from the field of medicine and rehab, what we would say is that nowadays we believe what is more important rather than having a right posture, it is important that you move. Movement is more important than sitting erect in a chair when you do your computer work. Okay, you can assume a posture which is comfortable to you, it's okay. What is more important is how many times you get up and move. So what is a very important takeaway from today's class is that ensure after every half an hour, 45 minutes, get up, move and come back and sit. Okay, so one nice advice we say, don't keep your water bottle on your desk. Okay, keep it away. Okay, so get up, go to the kitchen, have a sip of water and come back, and that is good. And when you get up, you can do the stretches, you can do the Shahrukh stretch and then again sit back to work. So this is one tip, is that move a lot rather than worrying about the right posture, rather than worrying about the right chair. Okay, there is nothing called as right. My posture is my individual posture. Okay, so don't worry about the right posture, rather than that movement is more important than finding the right posture. Few other things, it's very, very important in terms of musculoskeletal pain, and we treat a lot of patients with musculoskeletal pain. What we now have understood is that we call them as negative pain influence factors, which will aggravate or make your pain even worse, and there are a few of them. First is sleep deprivation. So ensure you are getting a good sleep of at least 7 hours. Okay, 7 hours of uninterrupted sleep. If you're getting that, the chance of you getting a musculoskeletal pain is less. So ensure you are getting a good sleep, a good uninterrupted sleep. Sleep is very important when it comes to avoiding postural and musculoskeletal pain. We now know that general fitness is very important. A person who is physically fit generally will not have musculoskeletal pain. So do invest your time in strength exercises, in your aerobic exercises, in your pilates, your stretching exercises. The person who is overall fit will end up with less aches and pains. So sleep, general fitness. Okay, other things which also contribute to this as definitely is your stress levels. Okay, so stress can itself contribute to a lot of musculoskeletal pains. Okay, so rather than posture being the reason, it could be stress, and it could be actually stress causing you a bad posture, because once you're in stress, your body subconsciously reacts to it. So ensure you can do some relaxation exercises, talk to the right people who are involved in this, and try to work on your stress. So stress, sleep and fitness, these three things go very long way in preventing musculoskeletal pain. Okay, small and short video, guys. Okay, I hope you liked it, and we will be back, I think so, next time we'll advanced animal flow exercises. If you have any questions, please put it, and we are very happy to answer to it. If you have any aches and pains, visit us in Positive Physiotherapy. Thane is also open now, and please visit R360. We have beautiful facilities, and they have a holistic range of exercises and other things which are there. Okay, bye guys, see you soon.